Welcome to The Explainer. So glad you're joining us, because today we're tackling something literally everyone has to deal with as soon as the temperature drops, the dreaded winter cough. You know the exact feeling I'm talking about, right? The air gets crisp, holidays are right around the corner, and suddenly it seems like half the people you know are coughing, wheezing, and just totally bundled up with some respiratory bug. But here's where things get kind of confusing, even for the most informed patients and parents out there. When that cough settles deep into your chest, is it actually an infection of the big airways or the small ones? Knowing the difference isn't just some medical trivia. It fundamentally changes how we treat the illness and protect our lungs. So wrap up warm and let's clear up the central confusion of the winter lung dilemma.
Okay, let's dive right into this. Bronchitis or bronchiolitis? I mean, these two words sound incredibly similar, don't they? They're literally just one letter apart. But they are entirely distinct conditions affecting completely different parts of your respiratory system. To really picture this, I want you to imagine the human lung as an upside-down tree. So the windpipe is your main trunk, and that branches off into two large limbs. From there, those limbs split into smaller branches and eventually into tiny, delicate little twigs at the very edges. Depending on exactly which part of this upside-down tree is actually inflamed, well, you get a completely different illness, which requires a totally different approach.
So looking at bronchitis first, this is inflammation striking the large and medium-sized airways. Think of those thick, sturdy branches of our upside-down tree. It's incredibly common across basically all age groups, from young adults right through to the elderly. But then there's bronchiolitis. Notice that IOL right in the middle of the word. This condition targets the bronchioles, the absolute smallest airways, those super fragile twigs at the far edges of our lungs. And because these airways are just incredibly narrow to begin with, bronchiolitis almost exclusively poses a threat to infants and toddlers under 2 years old. The respiratory systems are simply just too small to handle the swelling.
Let's shift our focus back to those larger branches for a second and talk about acute bronchitis. You probably know this by its much more common everyday name, the chest cold. When you have a regular cold or an upper respiratory thing that suddenly moves down deep into your chest, this is usually exactly what's happening. Your large airways get inflamed, and the main symptom is this hacking cough that often brings up mucus. You might even experience some wheezing, shortness of breath, and maybe a mild fever. Now, what's absolutely vital to understand here is the timeline. The fever and the fatigue, those might fade in a few days, but that pesky cough, it can persist for up to 3 weeks, and in some cases, crazy as it sounds, even up to 6 weeks. It's just a lingering, incredibly frustrating annoyance.
But here is the absolute most crucial statistic you need to know about acute bronchitis. 90%. In over 90% of cases, acute bronchitis is caused by a viral infection, things like the rhinovirus, influenza, or coronavirus. So why does that number matter so much? Well, because antibiotics